Assalamualaikum and hi, my name is Hannani. I will present to you our review study case. Genaral Hospital FCGH is a privately owned hospital that providing a broad range of healthcare services. Since the issues of customer opinion are being ignored, in ensuring the quality of healthcare, the board of Genaral Hospital FCGH has mentioned that all hospitals must pay attention to its customer perspective. To improve the current quality of healthcare, accurate information upon how the customer and healthcare professionals judge the quality of care is important. For instance, many hospitals has adopted some ways for clarifying patient satisfaction. In order to achieve maximum rate of customer satisfaction, hospitals need to gain information of obstacles faced by your patients through questionnaire. Moreover, these information are also needed for improvement quality of care, and that's why valid and reliable data on which to act is important. Hence, there are 14 steps in the RW's internal quality audit, such as quality to the customer, quality cost, design review, product qualification, and others. Thank you.
Assalamualaikum, my name is Afiqah binti Sudin, and I will answer in question number 1. How might a hospital measure a quality? A hospital can measure their quality by 3 ways. It is process measure, outcome measure, and by patient experience. Firstly, is process measure. Process measure is a process by consistently give patients a specific services that are followed with recommended guidelines for care. Recommended guidelines is a side treatment by hospital to patient improve their health status and of course to prevent future complication. For example, a nurse will check or cleaning a diabetes patient wounds to ensure the patient will recovery. Secondly is outcome measure. Outcome measure is to evaluate patient health status as a result of the treatment they have received. A hospital will make an assessment towards the treatment that has given to the patient, whether the patient is recovering or getting worse. A hospital also will look at the effect, intended or unintended, that care has had on patient health status and functions. Lastly is patient experience by provided a feedback on patient experience of the hospital care. A hospital must care about their patient experience, whether it is a positive feedback or negative feedback, because if it is a negative feedback, a hospital must take it as a serious thing and use the feedback to improve their treatment and facilities. A positive feedback from patient give meaning to clinical quality measurement that hospital process of treatment is effective or not. Overall, a hospital must have a continuous improvement, Six Sigma, and also employee empowerment to achieve their quality. Now, we proceed to question.
For question 2, firstly, hospitals need to make the transformation from the current practice of attempting to ensure the quality for measuring and improving the quality of care from both internal, which is customer perspective, and the internal, which means provider perspective. By doing this, workers, nurses, as well as healthcare professionals who work there will be able to correct their mistake and shortcoming, then treat patients even better after improving themselves so that they can maximize customer satisfaction at highest rate. Secondly, in order to develop greater social accountability, hospitals have to provide a quality healthcare at the best value as demanded by patients and payers. Hospitals should also have to concern about cost and medical practice variation so that they can give more stable and fair system to either poor or rich customers. In our opinion, a patient do not have to expertise to judge the healthcare he or she receives, because everyone have their own right to speak their voice regarding young, old, poor or rich. Even though young people's expertise is sometimes undermined and not being serious, but that does not mean they are disqualified to speak.
Assalamualaikum, my name is Aida Maisarah binti Zakaria. I will answer question number 3. How can the value of human life can be included in the cost of quality control? There are 4 costs of quality control, which is external failure cost, internal failure cost, appraisal cost, and prevention cost. External failure cost is accumulated as corrections are made to defects found after delivery of testing results to doctors and patients. For example, unacceptable turnaround time for test results lead to revise reports and recall results for a better service. Internal failure cost is accumulated as defects are found and corrected before results are delivered to doctors and patients, such as repeat testing, lost specimen, and high inventory cost because of over ordering supplies. Appraisal cost is the products of practice that are structured to detect defects in the value stream at every stage and maintain high standard of quality. For example, products, process or service auditing, calibration or measuring and testing equipment, validation of tools. The last one is prevention cost. Prevention cost is results from activities that keep defects from ever occurring. Hospital service help us feel better, such as quality preparation, team meetings for quality development, and quality education and training for patients. How are customer survey used to evaluate the quality of teaching at your institution? Firstly is competence. Competence is possession of the required skill and knowledge to perform the service, knowledge and skill of the contact and support personnel, research capability of the organization. For example, provide school with qualified teachers. Parents want their children to be taught by competent, qualified, and professional teachers. Effective teaching is based on the teacher's teaching experience and their performance. Secondly is tangibles. Tangible is physical evidence and representation of the service other customers in service facility, such as provide learning material, spacious classroom with furniture, boards, electrical fittings like lights and fans, and clean and hygienic toilet. The third one is credibility. Credibility is trustworthiness, believability, honesty, company reputation, having the customer's best interest at heart, personal characteristic of the contact personnel.
Or facilitating goods. The facilitating included the lectures and tutorials, presentations like supplementary handout document. The customer survey result used for physical or facilitating goods. The facilitating included the lectures and tutorial, presentations like supplementary handout document. Next is for sensory service provided. The explicit service includes the knowledge levels of staff, staff teaching ability, the consistency of teaching and the level of difficulty of the subject content and workload. The last one is psychological service. The implicit service included the treatment of students by staff, concern shown if the students have a problem, availability of staff, capability and competence of staff.
Hi, I am Aisyah. The answer for this question, first, responsiveness. Responsive teaching does not mean letting students do their own thing. For example, the student did not understand about the topic and then the teacher need to explain again for the student. The teacher cannot ignore that student and move to another topic. Second, security. A safe learning environment is essential for students of all ages. Without it, they are unable to focus on learning the skills needed for a successful education and future. Third, courtesy. Teachers need to be cautious to show the student that even when someone is disrespectful to you, you still need to be kind and respectful to them. Everyone knows cautious teachers teach students to be cautious also. For this question, firstly, create a balanced team. Forming a balanced team is one of the primary steps in the improvement process. The team should include a senior leader who can advise, provide oversight, and advocate for the team. Second, using wearable devices. Wearable devices are powerful tools to keep patients involved and invested in their personal health. Wearable devices such as activity trackers encourage patients to stay more active and healthier on their own.